ever tried reaching for something overhead, taking your wallet out from your back pocket, or relieving a back itch but find yourself wincing in pain? This may be an indication of a frozen shoulder. Hello, Namaste viewers. I am Dr. Nisha from PhysioHealer, and today we are going to discuss about one of the most common shoulder joint condition, frozen shoulder. Frozen shoulder is a condition that affects your shoulder joint. It usually involves pain and stiffness that develops gradually, gets worse, and then finally goes away. This can take anywhere from a year to 3 years. Starting with brief anatomy of shoulder joint. Your shoulder is made up of 3 bones that form a ball and socket joint. They are your upper arm, that is humerus, shoulder blade, that is scapula, and collarbone, which is called as clavicle. There is also a tissue surrounding your shoulder joint that holds everything together. This is called as shoulder capsule. Let's discuss pathophysiology of frozen shoulder. With this condition, the capsule becomes so thick and tight that it is hard to move. Bands of scar tissue form, and there is less of a liquid called synovial fluid to keep the joint lubricated. These things limit motion even more. What symptoms patient will feel? The main symptom of frozen shoulder are pain and stiffness that make it difficult or impossible to move the joint. If you have frozen shoulder, you will likely to feel a dull or achy pain in one shoulder. You might also feel the pain in the shoulder muscles that wrap around the top of your arm. You might feel the same sensation in your upper arm. Your pain could get worse at night, which can make it hard to sleep. In stages of frozen shoulder, you will typically go through 3 phases with frozen shoulder. Each has its own unique symptoms and timeline. First stage is freezing stage. You develop a pain, sometimes severe, in your shoulder anytime you move it. It slowly gets worse over time and may hurt more at night. This can last anywhere from 6 to 9 months. You are limited in how far you can move your shoulder. Stage is frozen stage. Your pain might be better in this stage, but your stiffness gets worse. Moving your shoulder becomes more difficult and it becomes harder to get through daily activities. And this stage can last anywhere around 4 to 12 months. Stage of this condition is thawing stage. In this stage, your range of motion starts to go back to normal, and this can take anywhere from 6 months to 2 years. Causes of frozen shoulder are as follows. It is not clear why some people develop it, but some groups are more at risk. Frozen shoulder happens more often in women than men, and you are more likely to get it if you are between the ages of 40 to 60 years. Your risk might also go up if you are in the process of recovering from a medical condition like a stroke or surgery, or like a mastectomy that keeps you from moving your arm. Certain medical conditions can increase your risk too. You may also be more likely to get frozen shoulder if you have diabetes. About 10% to 20% of people with diabetes get frozen shoulder. Other medical problems like heart disease, thyroid disease, or Parkinson's disease are linked to frozen shoulder also. Diagnose this condition. To diagnose frozen shoulder, your doctor will give you a physical examination. They will check it to see how badly it hurts and how far it moves. During the active part of the examination, the doctor will let you move your shoulder on your own. During the passive portion of the range of motion, they will move it for you and note down the differences. Your doctor or physiotherapist may decide you need an injection of an anesthetic in your shoulder or not. This is a medication that will numb the pain so that they can better judge your active and passive range of motion. The physical examination is usually enough to diagnose the frozen shoulder, but your doctor may also order imaging tests such as X-ray, ultrasound, or MRI to rule out the other conditions like arthritis or the rotator cuff tear that can also cause pain and limit how far it moves. Now it's time for some tips. Here we are going to discuss about some do's and don'ts if you have frozen shoulder. First thing is consult your doctor or physiotherapist. If you have the symptoms of frozen shoulder, consult your doctor to get the diagnosis. Do not self-diagnose the condition and self-treat because this can worsen your condition if done wrong. Diagnosing a frozen shoulder starts with a physical examination conducted by a doctor or physiotherapist. The physical is used to evaluate your shoulder's range of motion. Your doctor may ask you to touch your opposite shoulder or reach across your hip during the examination. They can also check your passive range of motion by asking you to relax your muscles as they move your arm in different motions. After this, they may order an X-ray to rule out the possible underlying conditions like dislocation or arthritis. Your doctor will recommend a treatment plan to address your problem and give you the instructions regarding rest and exercise. They can also refer you to a physical therapist. Take pain medications as advised and make sure you follow your doctor's instructions to ensure a smooth recovery. Use your affected arm. Keeping your arm and shoulder idle will not help with the healing process. Resting these parts all the time will only worsen your condition. One of the most common causes of frozen shoulder is reduced or total immobility, which may be due to factors like broken arm, stroke, recovery from any surgery or shoulder injury. As you keep your arm and shoulder immobile, the capsule that encases your joint thickens and gets tightened. On the other hand, if you perform gentle exercises as prescribed by a doctor or therapist, you can improve your shoulder strength and range of motion. Pay attention to your posture and sleeping position. Patients with frozen shoulder are vulnerable to reduced sleep quality. This is especially true during the first stage or the freezing stage, which is the phase when you feel the most pain. However, getting adequate sleep promotes the healing and reduces inflammation. To help you stay comfortable as you sleep, you can put a pillow under your affected arm with your hand resting on your stomach. If you tend to sleep on your side, make sure you don't sleep on your affected shoulder. Likewise, place your affected arm on a pillow across your chest as if hugging it. When you are standing or sitting, make sure you have good posture. Keep your shoulders back and avoid slouching or slumping to help ease your pain. What to do if you have frozen shoulder? Do not skip your physical therapy sessions. One of the most important aspects of your treatment plan is physical therapy. Your therapist will teach you exercises that focus on stretching the joint capsule. When your condition improves, you can move on to the strengthening exercises. If you have frozen shoulder, make sure you attend all the physical therapy sessions to keep your progress on track. The first few sessions are also critical because this is when they evaluate your condition and teach you exercises. With your therapist guidance, you will learn how far you can push yourself to avoid straining your shoulder when you do these exercises at home. Additionally, don't get ahead of yourself and move on to strengthening exercises without the approval of your doctor and therapist. Don't do activities that cause pain. While keeping your shoulder mobile is vital to healing and recovery, you should still refrain from moving your shoulder in pulling, jerky, and jarring movements. These movements will only make the pain worse and add more strain to your muscles. If you continue to move your shoulder in painful movements, the tendons in your arm will have to work harder, which may result in tendinitis. Some examples of these include walking the dog or playing contact sports without your doctor's approval. The frozen shoulder may take time to heal, so don't rush your recovery. If you like today's video, don't forget to like, share and subscribe us. And if you have any questions or suggestions for us, you can write down in the comment section below.